Okay, assisting in pediatrics in your textbook, chapter 40. So, PEDS for children. So, under 18 years, even if they're already hit puberty and look like an adult, sometimes you'll still see their pediatrician. Educate the patient. For example, when boys have fast growth spurts, their nerves don't catch up to their body, so they're super uncoordinated. So if you see that in your kid, don't think, dude, are you on drugs? No, it's just his nerves haven't caught up to his clumsy old body. So have you seen that in boys, right?
Mm-hmm.
They're big, lengthy, but they seem like they'll bump and hit in anything.
That's true. That is true.
Stages. We'll talk about life stages from infant and then all the other developmental stages in children. And then it'll help you guys are already parents, but to recognize your children's life stages will better help you plan. Intellectual and cognitive. So what's cognitive?
Like, how do you remember? Or thinking?
Yeah, thinking, recognizing, putting two and two together, right? So that's higher level. It's not instincts, right? So like a newborn baby, stick something in their hand, what do? They grab it. It's a grabber. Infant, brand new baby. Infant? Okay, next time. Oh, your kid has something wrong. It's the grasp reflex. Usually they grow out of it at like about 3 months, and then they no longer have their grab reflex. Once they get older, now they have pincer reflex, and then they pinch everything. So we'll talk about psycho and social. So neonate is 4 weeks. Newborn is 6 weeks. So sometimes it sounds the same, but neonate, just the first 4 weeks. And then after that, they are an infant. Fontanelle, soft parts in the skull. So you can see their head move up and down as they breathe. And at 6 months, those soft parts should fill in. So if it's not, they didn't hit the benchmark, go see the doctor. Loose, wrinkly skin. Why? No. They get their underskin, their subcutaneous fat after birth. So they look like old people, kind of wrinkly. And right after birth, they lose weight. And the weight they lose is all that fat under their body. So that's why they'll have loose, wrinkly, sometimes red skin. And it peels because they've been bathing in water. Just imagine you taking a bath for the last 9 months, right? Umbilical cord care. So watch out for infection and clean it. Jaundice at birth. So yellow because of the buildup of this protein. So this is from the liver or the kidney? Liver, right? So the liver is not clearing it, so it builds up. So it's kind of like a toxin that builds up, and it shows up as a yellow pigment. Easy treatment. We can give them light treatment. So that's why they'll put some newborns under UV light. Reflexes. So that hand grasp is a reflex. Also, if you touch the bottom of their feet, right, do they curl up or do they curl down? Yeah. Right? So if they're a newborn, curls down, I don't know, I forgot, or curls up. And then at a certain point, the doctor will hold the baby up, and it's the fall reflex. And they'll just hold them up by their midsection, and it makes them feel like they're weightless. Does the baby arch their back, or does the baby flex their back? So that depends on what age they are. So reflexes change as they develop. You guys know this reflex, right? When you rub their cheek, they start to suckle. Vision. They don't see anything. They just see dark and light, and then the colors come. and it's only like a foot in front of their face. So if you're gonna make faces at them, you gotta get really close. Stimulation is mostly sound, and like I said, those darken lights. Not necessarily bright colors, but changes in intensity of colors. Hygiene, give them sponge bath. So lukewarm water, tepid sponge bath. And then I know some parents who only bathe them like once a week, like a real bath. Everything else is just never prop, right? Because that's the bonding. So your child builds self-esteem at this stage. When they cry, you pick them up. You feed them, you entertain them, right? You do it quickly. If you don't, then they're gonna feel I'm worthless, right? Did you know that? Yeah, that's how they build self-esteem. And then for a long time, like physical touch as well, right? A child needs that physical touch. If they don't get it, they fail to thrive and they die as well. Jaundice, they get that UV light, helps their body. 1 month to 1 year. Now they are an infant. So grows quickly. So foods you got to introduce slowly at 3 months and 6 months because they don't have the enzymes to break down carbs and protein until then, respectively. Hand-eye coordination. Well, one thing is permanency. So if something's out of their sight, peekaboo is no longer there, right? So that's why they like peekaboo. If they don't see it, they don't know that it's still there. So that's why peekaboo still works for them. At 6 months, they'll know who mom is, right? And at 9 months, they'll be weary of strangers. They'll definitely know who my friends are, my mom, and my family is. So if you take a 9-month-old in a strange environment, they're gonna freeze. 6 months, not so much. They'll just look around. 1 year, hopefully they're not running around yet. But if they are, yeah, good luck. At 1 year, they get their, not palmer grass, they get their pincer grass. So when you're holding them, right, 9 months to a year, guess what they're doing? Picking your hair, picking your earrings, pulling stuff. If they're on the carpet, pulling out the carpet, pulling out everything. And you guys remember that stage, right? Immunization. So stay with the schedule if you want. Ask the doctor to space them out a little bit more, but try to get them all in. Introduction of solid foods, one at a time. One food every 3 to 4 days apart because you do not know your child's allergy response. So if you give them different foods all the time, you don't know what the allergy might be. So if you're going to start them with cereals, only rice cereal, right? And then you want to try something else, only the wheat cereal. 1 to 3, toddler age. So they're starting to get their freedom more and their curiosity. What they like to do is empty things out, put things inside other things. So all your cabinets, what happened? Everything they take out and then they put it back in all in the wrong place. So the best gift for them is cardboard box.
Yeah.
Potty training, only when they actually have sensation. So the nerves need to go from their spinal cord down to their genital area, right? And if they can't feel the tingle, they have no idea what you're talking about. If you try to potty train them too early, it's not going to work. But you can help them build kind of habits, like go when I go, now wash your hands, things like that. Also, because now they feel sensation in their genital area, they'll start to masturbate. It's normal, right? Because it feels good to them. And if you're an adult and you tell them, stop that, they're like, why? It feels good. So just distract them, and then usually they'll stop. 1 to 3, yeah, definitely. They'll start to recognize scolding. And this is where you have to watch out for abuse in pediatric patients. So if they fear their caregiver, then that's a sign. Or if they have no reaction to anything that's painful, like an injection, then that might be a sign, because then they're used to the pain. They don't want to go home, right? That's a big sign. Or if they're overly polite, because then they know once they get home, if they don't behave, they'll get in trouble. Play. So they'll do what's called associate play. A lot of kids will pretend to have a conversation. They'll talk back and forth. My turn to talk, then your turn to talk, and then my turn. But they're talking about two different conversations. One kid will be talking about butterflies, and the other kid will be talking about baseball. But what they're doing is they're practicing talking and their etiquette. So that's an example of getting their motor skills down. When do they start talking? Yeah, usually they're making sounds.
Yeah.
So about 3 to 6 months, they're already making cooing and babbling sounds. And that's what a lot of parents thinks are their first words, because it's usually repetitive sounds like dada, mama, nana, right? So that's not words, that's just them practicing. It's not until about 1 they put the words and their meaning together. They understand no. They understand no very quickly. No. 3 to 5. A little bit slow down in growth, but this is when their brain kind of stops that expansion. So they always say that first 5. That's when the brain grows. And then there's a little lull. And then at adolescence, their brain remaps because of the hormone. And then they don't become who they are until about 26. Your frontal lobe does not develop until then. So the milestones is get that kid stimulated as much as you can, because it's going to spark them until 13. Avoid any chemicals, because your brain needs to remap. If they're exposed to alcohol and drugs, it may not remap correctly. And then you're going to have to let your kid develop. I know, 18, get out of the house, but they're not a real person, I guess, until they're 26, right? Comfortable with themselves. So that means if you're still living at home after this, then maybe, I don't know, just kidding. Just joking. Nighttime continence. Uh-oh. 3 to 5. Here is where give them tasks that they can do. Because if you don't, they're going to feel unconfident, right? So that's the thing. You want to balance with them. So if you gave your 5-year-old the dishes to do, right? And they went ahead and they broke your wedding china, right? They're 5. What do you expect a 5-year-old with a bunch of china? So don't give them tasks that they can't do, because yeah, a little Freudian, it's going to stick with them. So let them do little things, little accomplishments. 6 to 10. So this is when they're probably at their best, right? Because they like to play games, right? They're very competitive and they like to win. And the kid always asks you on Saturday, can I go to school today? Right? Because they really, really love school. Like yesterday for the holiday, they probably was mad at you. Why don't I get to go to school? So you as the caregiver, if it's a 6 to 10-year-old that's in the hospital, you're gonna have to play games with them. You're gonna have to play cards, poker, video, whatever, because they need that type of interaction. They crave it. Rationalization. So this is when they start to learn to lie. They're starting to get good at it too. Yeah. So you'll probably see it 6 to 10 because for them, like let's say they spilled milk in the room. You walk in, what happened? They'll be like, you know what? A bird flew in the window and it was like flying all over the place and it landed, knocked the milk, and then it flew out. 6 to 10, um, they are very disciplined. If you have a child that has diabetes, so if they have type 1 or type 2, they're going to be really good because to them it's like a game, it's like a challenge. If I can keep my blood sugar low, I'm winning, right? So for them, you don't have to worry about certain things. They're going to be on the ball. They like school, right? Now when they hit 11 and 13 and puberty sticks in, it's the peer pressure. So individual, their own ID versus the group. So if they're not confident, starting when they're an infant and you didn't pick them up, right, when they're crying, then it's going to hard for them to build that self-confidence. They might then need to identify with the group. So if your kid has purple hair, guess who else has purple hair? Their friends. If your kid got a hole in their nose, a hole in their cheek, guess who also has it? If she listens to all that sad emo music, guess who else listens to that stuff? Right? So yeah, they do crave it. They're gonna fight. This is the tween, right? You ever heard of that? The tween. They're not quite teenagers yet.
Oh, like preteen.
Yeah, the tween
Okay.
years, the pre-tween years, the in-between years, and that's the middle school years. So if I was to teach, I would not teach this grade. I would teach K through maybe 3. That's it. Hypercritical, yeah, they're sensitive. I have 5 nieces. So yeah, from age 8 to now 18. So I have the whole gamut of sensitivity. Physical development. So this is when you determine between a child and an adult is the onset of puberty. So in CPR, it's breast development for girls and axillary underarm hair for boys. Then we'll treat them as an adult. 14 to 19. So again, that's kind of in between. Their brain just remapped at about 13, and now they won't be really a person until 26. So those in between years. So if you don't fit in, they will turn to other ways to deal with anxiety. And pretty much any disorders is what we do to deal with anxiety. Eating disorder, you're anxious about something. Substance abuse, you want to avoid something, you have anxiety about it. So a lot of these changes in their behavior is just normal, like sleep patterns. Teens are erratic, but it can be the signs of depression. Other things like weight gain, weight loss. Teens are erratic, so you really got to pay attention. So yours is 4. How old are yours?
One's gonna be 2, the one's gonna be 5.
Okay, so yeah, you guys have about 10 years to go for those teens, right? But if you keep open communication and understand, you know, their development, it's easier to manage them. Like the 4-year-olds, I know that they have that intact image, and last time we gave them all band-aids, and they loved them, right? Did they go crazy on 4th of July? It was like birthday, Christmas, all rolled in one.
My daughter's baby has a band-aid over her forehead,
Oh my
on
god,
his
that's
foot.
so cute.
Oh, instruments. So depending on the age, you may have to try it out. For example, if you're having like tonsil surgery, afterwards we're gonna put an ice collar around you. If the kid is 10, they probably know what that is, right? You just tell them, hey, this is gonna be this cold stuff around your neck when you wake up. They're like, oh, cool. If it's a 4-year-old, you might want to try on the ice collar before the surgery. Say, hey, this is the ice collar. You're gonna wake up with this on. You want to try it on now, right? So you know what it feels like. So you have to change your education based on their age and development, and instructions based on their understanding. Examinations. Okay, so this is the schedule. So when should their birth weight double? Yeah, by 6 months. That's the benchmark. If they don't reach that, then no. If they didn't reach the benchmark, they fail. But if they surpass it, doesn't matter how far they surpass it, they're okay. When should they have good smiling by? Good smiling.
By 9 months? A year?
No, 3 months. Oh my God.
What?
Yeah, a child should be able to recognize your face. That means they should be able to smile before 3 months. They should be able to recognize their caregiver. So she didn't pick up her kid, so 9 months.
You said good smiling.
Yeah, that is good smiling.
Oh.
The kid should recognize that's mommy's voice, smells like daddy, and smile, right? So that's good. That means if it's afterwards, they did not reach that benchmark. Could be the sign of neglect, right? Because they don't know that's supposed to be a happy person. Getting treatment, right? And then the other examinations. So a year and a half. I think the height, right? Height's supposed to double in about a year and a half. A little rusty. I have no kids, so once I get kids, um, it'll be entrenched. And then every 3 years, or after 3 years, it's just their annual checkup. Schedule more. Some insurance company do twice a year checkup. Immunization. Just follow the record. You need consent.
That kid's so calm in that picture.
Stage. That needle's going in way too slow.
Yeah.
All right. So, did you guys practice
Yep.
Farm 107? The quicker it is,
Yeah.
the less it hurts. Because when you do slow, it pushes and then tears. So, especially the hip, I saw some students, they go, nice. I was like, I can feel the pain.
Yeah.
So, for children, you may have to immobilize them. For small children, easiest if it's to the thigh, the latissimus valeralis. Have them in the mother's arms, legs wrapped around the mother. If it's a kid 5, 6, you can put them on the exam table and with your chest immobilize their legs and then give them their thigh shot. So do not separate young children from their mother. If you want your ears to stay intact, do not separate the kid because they'll scream. And I have a student that she's pretty much deaf now because that was her job, was just hold the kid down while the nurses and doctors give administration. So they just scream right into her. Similar to vaccines or toxoids, especially for not the bacteria itself, but the toxins the bacteria makes. So tetanus, it's not a vaccine, it's a toxoid. It's something to tell your body, hey, look out for this toxin and eliminate it. So of course, tetanus causes lockjaw and muscle paralysis. Yeah, that's where the bacteria may live. So it's not the rust that causes it, it's the presence of the bacteria. So now California has eliminated its philosophical reason for not getting vaccinations. So in California, you can reject if it's medical, religious, all right? But I'm a smart kid. I know that vaccines cause autism, so I'm not allowed them. So you can't think your way out of vaccines anymore in California. So only medical or religious reasons. So follow the recommendations, and a lot of them are given together in groups, like the MMR. What's that?
Mumps, measles, rubella.
DPT. What is that? Diphtheria, pertussis, and tetanus, right? So a lot of them, you don't have to get them individually, one shot at a time. Now they're all combination. Makes it a lot easier. Keep your records, and then check for reactions. What happens if you lose all your immunization records? What happens?
Can't they just print you another one?
No, you lost the record.
Computerized.
Yeah, but what if you never got them electronic? How would they know if you got them or not? Blood test, easy. They test for the antibodies in your blood, right? So it's not an end of the world thing. It might cost you some money.
There, even if it's like from years ago.
Yeah, your immune system remembers it. So all they do is take some blood and then they search for it, see if it's. Well, remember before electronic health records, everything was paper. And if you had a doctor and you moved, you have another doctor, maybe it didn't transfer over, or maybe you didn't keep your records. So it's not the end of the world, it just takes some time. Some are frozen, like polio. I think polio is frozen, and most of them are in the fridge. So keep it at 2 to 8 degrees Celsius. Screenings. So you guys had questions about comparing against the average. So that is the percentile that your child is in. Less than 5, you're going to need more of a core temperature for measuring. So use the axillary or rectal. Body measurements. So head circumference for infants, they might do chest as well. And then height and weight every year afterwards. General eye. So what does it mean to have 20/20 vision? Perfect.
Perfect standard.
That's like average. You can actually have better vision than 20/20. So there's some people who have like 10/20 vision. No. It's their visual in general. That means they can see better at a distance. So 20/20 is like the good average. So for children, no letters, you're going to use shapes. And then once they get older and they recognize letters, you'll use the letters. Throat culture for strep throat. So what they're doing is they're looking for a beta bacteria with the throat culture to confirm streptococcus. Urine, blood, just like adults. Don't make assumptions. And then why not aspirin for children? Not because it's acidic, but in adults, you know how it thins the blood? So it causes a condition called Ray's syndrome. Hydroencephaly. So there'll be water on the brain, causing pressure, coma, and death. So kids, give them Tylenol. 81 milligram. That used to be called children's aspirin. They don't call it anymore. They call it low dose. So the name changed in the last couple decades. And it was chickenpox that kind of brought it out, because when kids had chickenpox, they gave them aspirin for the fever. Ray's syndrome. Lice. So one kid in the school has it, they check the whole school. The only time they need to check for lice is when there's a reported case of lice. So if you remember back in grade school, they were checking for lice, that's because some kid had lice. They don't do it randomly. Herpes simplex, 1 and 2. 1 is oral, 2 is genital. They're kids, so yeah, they can get them there too. So it's just a virus. Bacteria, very contagious. Make sure you use your PPEs before you enter the room. Pinworms. When should you check your kids for pinworms? Mommy, my butt's itchy. So at night, the pinworm pops out of the anus to lay their eggs. Scratchy, scratchy. You go in at night, check to see. So what the kids do is they'll scratch their butt. They got the larva on their hands and back in their mouth, and the cycle repeats. Fungus. I forgot the end. So ringworm is a fungus. It can only eat dead stuff. So it's eating dead skin where you contact. And as it eats that layer of dead skin, it has to go out further and eat the next layer. Hence the ring pattern. AIDS. What causes AIDS? HIV. So it's the same virus. This is when your T cell count below 200. Juvenile rheumatoid arthritis. So your own immune system attacks your joint cells. It's progressive, and it's usually adults. But here in children, it's going to severely deform the joints. Is ADHD real?
Yes.
Is ADD real?
Yes.
So sometimes it's diet, sometimes it's habit. So for some of these children, if you change their diet, change their habit, those symptoms go away. Sometimes kids are just full of energy, and one way to slow them down is to drug them up. So if your kid has energy and the school recommends it, or if they are in child protective services and they have too much energy, oh, you must have ADD. Let's give you some meds. So if your kid ends up in CPS, most likely they're going to end up on some psychoactive meds. So be careful. Cerebral palsy. They don't know what caused it, but development of the brain is damaged. So it could be mild to very severe disorder. From birth. Congenital heart disease. So sometimes the hole doesn't close, the ovale, the foramen ovale, the hole between the left and right atriums. So it'll cause a murmur. Down syndrome. So we have 46 chromosomes, but here you got an extra one, and it's usually the 21st set. So you have 3 copies. 1, 2, 3. Can a Down syndrome person be a father or a mother? Can they? Did you watch Corky?
No.
They can?
They can't?
I don't know, can they?
I think so.
So what kind of chromosomes do they have? What kind of sperm and egg? Their chromosome count is 47. What would their sperm and egg have? No, it's supposed to have half. 23.5?
Yeah, you have to go there.
Or, oh, yeah, so look it up. Hepatitis B, bloodborne and bodily fluids. Hepatitis A is water. C and D, you cannot get D unless you got B. So as long as you don't get B, you'll never get D.
Which one's the worst, A?
B, C, and D, because these are gonna attack your liver. This one, yeah, it still can be bad, waterborne, but it's mostly diarrhea. So San Diego, you should know, because that's our problem. You guys know that, right? With the homeless, there's been a few deaths, and it's hepatitis A, and it's mostly dehydration that causes death. So if you get an IV, you're fine, hepatitis A. B, C, and D, it's going to attack your liver, might damage it and kill you. RSV, so we have infection in the lungs. SIDS, do not place your child in what position?
On their stomach.
Yeah, do not put them prone.
Oh yeah, prone.
So on their stomach's the same thing. But you can put them prone for a few minutes to play. It's just when they're sleeping. Put them sleep on their back. It's good to get them. Spina bifida. So the spinal cord does not completely close. So there's two types. There's where all of the spinal cord material stays inside. And then the other type is when some of it sticks out. Child abuse or neglect. So we talked a little bit about this. So parent, primary caregiver, watch that relationship, that fear response, the no crying when they get injections or something that's painful. They don't want to go home with their caregiver, or they're overly polite and in good behavior. Injuries. What type of broken bones might be abuse? Usually it's spiral fractures because it's you grab and twist a little kid's arm, their bone breaks in a spiral. If a kid fell, right, that's a regular break, right? But if it's a twisting fracture, no way a kid is gonna stick their hand somewhere and twist it off like that. Bruises, right? Different colors. So why didn't you come in with the first bruise? Why did you wait for that one to turn yellow, that one green, that one blue, and this one fresh? So how long has this been going on? So your job is to report. You're not determining anything. We talked about burns, right? Where do they usually burn children?
On the face or the arms.
Where it's not seen. So if a kid is wearing a long sleeve shirt and it's hot, something might be wrong. Why is this kid in a parka jacket and it's 90 degrees, right? They're covering something. Bottom of the kid's feet. Cigarette burns. Burns in the bathtub, right? If it looks like a glove, if it looks like a sock, they stuck the kid's foot in hot water, right? The donut burn, remember? Told you about that? So if their butt is on the bathtub, the hot water is going to burn everywhere else except the part that's touching the bottom of the bathtub. So again, it's sad to say, sad to talk about, but yes, just there are bad parents out there. What if vaccinations aren't up to date? You have to report that because that's a sign of neglect. Why isn't this kid getting to the doctor on time or as scheduled? Malnutrition. I don't think we have a malnutrition issue. We don't have a starving issue really in America because there's always food. All the homeless around our area we see, there's no skinny guys, right? There's tons of food. It's another issue for the homeless. But for children, it's a lot of them get stuck to just eating one or two foods. So the best thing for you to do is to just let them try it. Just keep on putting broccoli on their plate. 100 times they might not even try it, but that 101th time they might just try it and then ask for more. So you just gotta expose them. So it's chicken nuggets and french fries all the time with ketchup. That's not good because they're addicted to it. They're addicted to that sugar and salt and fat. That's all they're eating. Kids have stress.
Or when their toys would be put in.
My daughter.
No. That's like first world problems. But yeah, we do have a lot of issues now because of social media. 5-6-year-olds have cell phones and they have their own accounts. So it's getting crazy for you guys to be as adults, be it parents. Eating disorder. Anorexia. What's worse, anorexia or bulimia?
Anorexia.
So this is no eating. This is purge. So you eat and then you throw it up. Binge and purge. BING. So bulimia is worse because digesting, your body's investing all that nutrients, all that energy, right? A
But you
third.
Get a little bit of nutrients, right?
Yeah,
The
but you
acid.
threw it all back up.
True.
So that's one sign, the eroded teeth.
Yeah.
But anorexia is not so bad because we can give them a liquid diet. We can make them drink their calories. And then usually no one talks about chew and spit. So it's usually with sweets because they have a disorder, psychological disorder. So they get the pleasure from chewing on like Oreo cookies, sucking on the juices, but then they'll spit everything out. So they still get the pleasure, but not the calories, psychologically. And then we mentioned substance addiction will be hard to detect if you don't have a good relationship. Keep it open. Talk about anything and everything. Don't judge them. Don't discipline them. I know it's hard, ladies. Violence. So for relationships, a lot of teen relationships, violence is just normal part of it. So be careful. And then suicide. Actually, our culture is not too bad. There's other cultures where suicide is acceptable. Suicide is actually honorable. So they'll have high rates. So in Japan, suicide is honorable. Like, for example, if a girl is going to be raped, it was more honorable for her to kill herself and then get raped. Because in America, survivors of rape and sexual abuse, they feel guilty because they allowed it to happen. Right? So different cultural takes on it. And then in the Polynesian culture, right, the islanders, they have high rates of suicide. STIs, your child having STIs, a lot of questions. But information, I think schools, when they do sex ed, they don't really give them the real facts.
Mm-hmm.
Right? They just give them the standardized curriculum. All right, not too bad for assisting pediatrics. It's similar. It's just a few precautions based on their development level.